You were constantly squeezing people in. You were double booking, triple booking, trying to survive to get through the day. I was wearing out.
You come to work and you feel like you're on a treadmill all day long. 23, 24 patients a day, sometimes more.
It wasn't what I went into medical school to do. I was pretty close to burning out.
Basically a dead sprint from the moment you got there and really taking a lot of personal sacrifice. Right now, the worst day here is better than 90% of the days I had in my other practices.
This is what we should have been doing all along. And the medical home model pretty much just sets us back to get the priorities where they should be and make the patient and physician a team, make your team, your nurses, your MAs, and your pharmacists all part of the team, and let the patients know that and let them know that they can talk to all of us often, not necessarily just have to get sick to do that.
The medical home is not a physical space, but rather the philosophy of care and the relationship between the personal physician and the patient and their family. The team here has really felt empowered to design different strategies to reach out to our patients and connect to our patients.
I love this campus. The Factorial one's great, as you can tell. You come in and you know everybody. Everybody knows your name. You feel totally comfortable contacting your doctors about anything. There's no dumb questions, especially with the online. They have you can email your doctors anytime. That's awesome.
I'm having this problem. What can I do for this? What are your suggestions? A lot of those things can be done through email. I do a lot of follow-up through email, so it saves patients having to come back in to simply go over lab results. More than 50% of my patient encounters are email.
I had my procedure, and I had gained a little bit of weight since I saw Dr. Seaver. And I was thrilled. About a week later, he sent me an email and said, "Hey, I see you gained some weight since I saw you last. Did everything okay?" And he just wanted to check in with me. So working with Dr. Seaver, having lost some weight, I'm very excited to say that I've gone from taking 4 medications a day down to 1.
The electronic tools, especially email, allow me to intervene more quickly and help my patients make their lifestyle changes sooner.
Doctors are not gods. Ultimately, my own personal health belongs in my hands.
This is a way to give care that's needed to the patients in a sustainable fashion. It actually gives more time at the primary care level of care, hopefully to prevent needing time at the specialty hospital emergency level of care.
They take good care of me, and if they say anything I don't understand, they will explain to me what it is if I ask a question. But first you got to ask.
What we have here is kind of a paradigm. We've got a real protocol on how we approach chronic illness. The hope is, doing all this planned work, that we will see reduced emergency room visits. I really believe it's going to save healthcare.
The patient is the center of all of this. It all should come back to their one center place where they know that someone's seeing the whole picture for them, making sure everything's done for them. I can't take care of all my diabetic patients. I know what they need, but if I teach them, if I get a plan that they're willing to buy into and begin to work with their disease management, then the outcome for them is going to be so much better in the long run.
You don't have as many patients to take care of, so you have time to do this. If we go into the medical home model elsewhere, we're going to reduce your workload on number of patients, but it doesn't mean you're not going to be working hard, and you'll be actually better able to take care of your patients because you'll be working smarter.
Hi, Nisha. How are you? Hey, I hear your mom's having some
I'm
problems.
not running around putting out fires. I'm looking for fires to prevent. I'm actually having time to think about, okay, this patient called for this problem. Is there anything else I can do while I have them on the line? The thing that's inspired me most is how I feel at the end of the day. I am happy. I'm a little tired, but I've had a good day.
Alrighty. I would like to see it go co-op wide because it makes such a more positive environment to be in. And it decreases so much stress.
We have a system that makes people feel good about what they're doing. Now that doesn't mean you aren't working your tail off, but it's sustainable and you can do it. And if there's light at the end of the tunnel, and it's called the medical home model.
I'm better able to take care of myself and my family, and in turn, I'm able to provide better care to my patients.
Just that part of it is a huge difference.